Do we have anyone in the meeting who has already done some kind of research, maybe even published something?
Yes, doctor, we have.
You have. Cool. Um, my plan was to go through research, technology, and innovation in global surgery. Why is it important? What is it about? And where could you guys start at from where you are right now? So I think I'll take about 15 minutes and then I'm open for questions. All right. A disclosure, I'm a global surgery fellow with the University of Global Health Equity, as Felix has already said. And following the philosophy of us standing on the shoulders of giants, my thoughts and views on research have been heavily influenced by other people's thoughts and ideas that are senior to me and have guided me through some of my research work. And I want to name Prof. Abebe Bekele, Dr. Barnabas Alayanda, and Dr. Godfrey Sama. And there are many more people. And I think if you start your research journey, you will also be inspired by people and they will help shape your worldview a bit. So let me start. What is research? Research is a systematic process involving the collection, organization, and analysis of data to find answers to questions that are unknown prior to engaging in the process. So, and I highlighted a few words. It's a systematic process. We collect, organize, and analyze data, and we want to find answers to questions that we didn't have before. So, all research starts with curiosity and a question. And that curiosity leads to new knowledge, new answers. And ideally, those answers will lead to action. So if you start engaging in research from the get-go, the most important thing I would ask all of you is be curious and ask the right questions. So questions should be relevant for your context, and they should be answerable, measurable, and so on. So why are we talking about research in this context? And I mean, I guess you're medical students, you might want to become clinicians, so why would you do research on top or as a main thing? Um, so I think research can be done in any context, in addition to what you're already doing. So I brought this mug, which I saw at a presentation at a research workshop, which I really liked, saying research is what you're doing when you don't know what you're doing. So even as medical students, you might already start doing things and you're asking questions. And some of those questions you might be able to turn into research because it's not just you who's interested in that, but also your seniors and your colleagues. And who knows, maybe something interesting comes out of it. And then eventually you might be able to do important research, which is what you're doing when you don't know what you're doing, and you're being paid for it. So there are a lot of reasons to do research. Um, some just think of it as personal gains. Like I think in our field, especially in medicine, if you want to progress into higher positions, you have to do research to get a promotion, to get additional funding because you have nothing else to do. Maybe eventually you want to shift out of the hospital and just do research. And then we also see others doing it, and you're like, okay, that looks interesting. I want to do it too. So those are reasons. How like I think they're valid reasons, but you should also be guided by um, curiosity. So do research that interests you. Maybe you are also motivated to do research to improve the work you're doing to make the world a better place. Um, and that's my next big takeaway. Data to action. Your research should always be translational. Don't just ask questions for the sake of questions. Ask them because you want to improve something in your context. So the talk today was not just about research, though. It's also about technology and innovations. What roles do technologies and innovations play, and what are innovations? So, I think especially in the place of global surgery, there are a lot of technologies and innovations nowadays that are trying to improve our work in the hospital and in health systems, trying to improve access to care. And I brought a few examples. Maybe you know them already. Ssession, for example, is great as a learning hub and is an innovation to improve access to medical education. And then Stitch is an example for surgical models to train students. Ohana One and Proximy are trying to improve mentorship in the operating theater. And we nowadays even have a conference on innovations in global surgery, which is called International Conference of Innovations in Global Surgery, following the logo in the top left corner. So if you're interested in innovations, have a look at that. And innovations don't have to be immediately become these big companies as that you see here. They can also just be a small improvement of a process within your hospital. Maybe you see that your consent forms really take a long time to fill, and you can come up with a new design that improves the timeline of consent form filling in your hospital. That's already an innovation. So start within your context and then move from there. If you want to look back to research, what other research designs you might want to consider when you want to do research? So you have a question. Now the question is, how are you going to answer this research question? And I think this pyramid, if you start looking into research, is something almost everyone knows. It's the hierarchy of evidence value. So at the top, we have systematic reviews and meta-analyses. So someone is going through all the research that has been done in the past and trying to conclude from that collection of research what is the main finding, what's the conclusion if you take all these different studies from different settings on the same question together. Then we have randomized controlled trials, very common in clinical research where you have a control group and a test group, and you randomize people in those two groups and then you compare outcomes. Then we have cohort studies and case control studies. There are similar set as randomized controlled trials. They can be prospective or retrospective, and you don't have as much randomization or blindness. And then we have case series and case reports, where you might come across something interesting in your hospital that is very rare and not very common, and you just write a paper on it. And lastly, expert opinion or anecdotal evidence. So a lot of journals would prefer some of the first three research designs and less of the last two because of the value of evidence that you create. But it doesn't mean that a case series is uninteresting. It depends on the context where you want to communicate your research findings. I'll get back to that in a bit. And also, the field of research is evolving. So there are a lot of new things now. It's like we have real world data now, where instead of doing active patient enrollment, you can use electronic medical records, not just from your hospital, but from multiple clinics, and evaluate them. We are moving into AI, of course, so big data is an interesting thing, and especially for the African or Asian continent, because a lot of big data and AI-based tools, also in medicine, are not customized for our context, so for the Asian or for the African context. So if you look into that, it's very interesting to find out how to start building AI models that are relevant for the African context. Then we have qualitative research, that doesn't fit into any of the things I showed, but it's still interesting to see, especially if you talk about community engagement and community-based research, because you get to really learn about the lived experience of people that you want to help. And then there's quality improvement where you don't follow a strict research design, and it's more trying to improve what's going on. So, and very iterative process within your working context. And that's for example, something you can start with. And then lastly, something I'm working with at the moment is implementation science, where you don't just want to evaluate a theoretical model or where you just want to collect data, you're actually implementing findings that other people have, and you implement ideas that came from other findings, and then you collect data while you implement to prove that the implementation is actually working and how other people might learn from your implementation. So with all this knowledge, where can you guys start right now where you are? So first, if you want to do research, you should start with a research question. And what are sources for research questions? It could be your patients. It could be something you experienced in class. It could be something you experienced on the ward. It could be because you're interested in a certain topic already and you start reading research papers and you realize, hey, there's one question that is not answered by my research, by the papers I've read. You could find the research question by talking to your colleagues, or you can find them within your hospital and institution, especially when you think about quality improvement, and many more. So your research question is guided by your curiosity and your experience, and by you keeping your eyes open and just looking around and thinking, what could I improve? What is something that I see, but that I don't fully understand yet? Um, And of course, you might have some barriers that you face, lack of funding, lack of time, you lack support by seniors, you don't really know how to do research yet. But those are just challenges you can tackle. They will not keep you from research. So what are solutions? You're already here. So you joined a mentorship program. Good. Now you can find a mentor here, but you can also look into what are senior students doing. Maybe they're already doing research, they're looking for an assistant, they need help. Try find some of those. Find mentors within your context that are already working in the field that interests you. And then also start small. Not all research needs great funding. A literature review, for example, you don't really need much funding. You might need a lot of time, so find a team as well to work with. Don't try to tackle any research by yourself. Do a local QI project within your hospital or within your medical school. Maybe there's something that you could improve. Like with our master students this year, one of the quality improvement projects had nothing to do with the hospital per se. We restructured the dining area, and that was a little QI project. So if you start small, you can also experiment a bit with your methodology and your way of thinking. So even if the findings are not groundbreaking, you have learned something and you've become a little better in your research. And the most important thing, just start. Write something, come up, think of something, and then from there, just take it one step at a time. And then when you have found something, however groundbreaking it is, how could you communicate your findings? That's, of course, the most classic way of communicating research is publishing it as a research paper. And then you should think about which journal do you want to target, what is relevant for your context. Should it be open access? Can you afford publishing fees? But nowadays, a lot of journals have waivers, especially if you're from low middle income countries. So yeah, that's the most classical. But also depending on what your research is on, you can use social media to communicate your data, especially if you want to do advocacy, like not pure research, but advocacy to improve knowledge within a certain community. And social media is great for that. Like if you look on TikTok or Instagram, there are so many medical influencers, nurses, medical doctors talking and trying to improve knowledge on healthcare topics in a entertaining way. And one of my colleagues, Dr. Alice Umutoni, did research on social media and plastic surgery, and she found that the quality of videos, especially on YouTube, is not really good. So if you are interested in social media and content creation and you're a medical doctor, that might be something you would like to look into. Um, Create videos, entertaining educational videos on medical content that leads to your communities being better in identifying diseases or seeking healthcare. And then lastly, of course, you can communicate your findings on conferences. And when I say conferences, I don't mean just the big international ones. So of course, if you have interesting findings, submit them to any conference in the region or somewhere else that you find, especially that target especially young researchers. Like we had the medical education conference in Ethiopia the other week, but there's also COSEXA coming up. And there are always small conferences that are interested, especially in young researchers, like the International Conference for Innovation in Global Surgery that I talked about later. Might also be something. So you can send abstracts there and hope that you get invited. But of course, that's always connected to funding difficulties and such, although a lot of conferences also offer travel grants. You just might have to look into it. But in addition to international conferences, I was also thinking about internal conferences. So if you have ward rounds or mortality and morbidity conferences within your hospital, that's also a place to start and communicate findings. You could start a journal club within your institution and inspire other people to do research by discussing papers together and reading them together. So yeah, don't just think of journals. Think of anything other that's a little outside of the box and start. Yeah, and then lastly, where can you find resources that are connected to research? So first, you're already connected to an institution, to a university. A lot of universities do research. So find out what's going on in your institution. Again, find a senior, find a mentor that might be able to support you. Talk to other students. Develop your ideas of what you want to do and talk to your classmates, talk to your senior classmates, talk to your junior classmates, and just see what's happening from there. Maybe you already have journal clubs within your institution. That's also a good start to find like-minded people. And then also think about what's going on outside your institution. There are international student groups. I think a lot of you already know Ssession. If you want to look into research methodology, there are online research courses. You can check out Harvard's website, Stanford, Oxford. UTHE offers a scientific writing workshop once a year. So keep your eyes open for that as well. There are a lot of online resources that you can use to learn about research. And then lastly, just read papers. And then if you read them, don't just look at the findings, also look at the methodology. How have they done that? How would you do it in your context? And ask questions, talk to other people about these papers. So if there's no journal club yet, open one so that you can read those papers together and ask those questions. And just by chance, I stumbled upon it yesterday on LinkedIn. Incision is offering a research foundations program. So for anyone who didn't know about it yet, you could just scan the QR code. I'll leave it here for a few minutes or for a short time. The first session is tomorrow evening. And it looked interesting. So you will be talking about how to start with all these things that I talked about. How do you find your research question and how do you find the appropriate way to answer that research question? Okay, we're reaching the end of my presentation and I want to leave you with the question, now what? So again, stay curious. If you want to do research, try and ask the right questions. And if you have the question in your head, find support. Don't work alone. Research is teamwork. It's not a solo adventure. And then also be proactive. Like research doesn't start by you sitting in your room not doing anything. You have to read and you have to develop your ideas, and then you have to talk to other people. Be flexible. Your research question might change over time, and even your research interests. can change over time, and that's fine. Just be sure that you follow a systematic process. Also be aware of your limits. So even if you have an amazing research question, maybe it's not within your scope of work yet. So try and break it down to what you can realistically do now today. Like maybe start with as I said, start with a literature review. That will also help you refine your research question further. And also, lastly, be mindful. Research is fun, and I love research. It's great. You get to be so curious, ask questions, do a lot of things. But be careful. Keep in mind that your research is not just for yourself. It should always be ethical, and it should be useful for the communities that you serve. With these few closing statements, I hand it over to you, Felix, and welcome any questions.